Yeah, I mean, I think as we get more tools, more treatments, personalized medicine becomes more and more important. I think sometimes we see certain treatments become a little bit more mainstream, and so we might kind of jump from one treatment to another or things like this. But I think we're getting to a point where we're going to get treatments potentially, if and when, probably more so, more appropriate when tolebrutinib gets approved, where we are going to see options for treatment for progressive patients being different from treatment of relapsing MS. And so we're going to have to tease those things out. I think in the past we could say it was MS, was it aggressive MS, and go to high efficacy, low, sort of escalation approaches. And as we start to get more of these tools, we can start to look at, hey, not only in addition to that, but is there some progression, things like this. We've been able to measure it, not maybe very well, but recognize it. And I think as we get these options for treatments, that we're going to have to start thinking about how we're going to use these treatments. Are they going to be able to be added on to other treatments for the relapses? Do we rely on them well? Do we think they're going to work good enough for relapses? And I think that's going to be the challenge for it. I think as we have some of the other tools around biomarkers, that we're going to be able to pick up maybe some more subtle changes that maybe we did in the past, as we look at slowly evolving lesions or paramagnetic rims, that drugs that maybe have an effect on that, which I'm not sure that we have yet those, but I think as we start to kind of see what effect our drugs might have on those changes on MRI, that we might start being able to add those therapies on, or switch to those therapies that might have a bigger effect on those biomarkers. So far, I think we've relied on patient-reported outcomes the most. Relapses are patient-reported. We try to verify them. We try to kind of assess them, and try to sort of assess them maybe more objectively later. But at least the initial presentation usually is, just it starts off as like a patient-reported symptom associated with it. Progression definitely much more so is a patient-reported measure. I think sometimes people call it sort of the Joey question, how you doing, and it's like, you get the thumbs up, great, you get the thumbs down, it's like maybe there's some progression there, and so it's probably not the most objective way to do that, but I think it's still sort of our best indicator as to where things are at. We would like to see more objective ways to measure those things, and so I think that's where the remote monitoring is going to happen. We can do telehealth visits, which has been great. It's been, from a convenience perspective, I think awesome, for the patient and for the providers. But the ability to do more measurements objectively around function, I think is going to give us really the way to measure how patients are doing from a progression perspective. And so I think as we look at how do we measure that now, we're very bad at it. All the measures that we use in clinical trials are really bad at it, but it's what we got. And I think as apps come up, as different tools come up and devices, I think we're going to start putting meat on the bones as far as being able to come up with how to measure it, what these changes mean, how much of a change are we actually seeing, do the drugs have an effect on these outcomes, and those things. So I think we're getting into a world where we're thinking about how to do it a little bit better. The concerns a little bit with patient-reported outcomes with this is that they are also patient-reported, so at both ends of things you end up with some issues. So if you have a patient that is, maybe for lack of a better term, happily demented, everything is great. And I've had patients come in and, on the PDDS, the scale, just kind of who are wheelchair bound and just put down 0. It's like I'm completely normal. You have patients that are, walking into their appointments and reporting that, they're needing sort of wheelchair assistance. And it's just like, I just feel terrible. I don't have any energy to do things. And you finish your exam and they look really pretty good. And they're having symptoms, but how much disability may seem that way, but it makes our other measures, I think, a little bit more confounded.